Good morning, good afternoon. So to continue our series on congenital defects, we're going to talk about neural tube defects, how to screen and how to diagnose. For those of you who don't know me, I'm Dr. Heather Stanley. I'm your pregnancy specialist, and I want to welcome you to our weekly live. So before we talk about what a neural tube defect is, let's talk about what is a neural tube defect. What's a neural tube? So the neural tube is actually that template that forms the brain and the spine, and it has to fold. So if you just figure like a piece of paper, it has to kind of fold and then it has to close in order for the brain and the spinal cord to be completely formed. Now this closure and fusion starts, it's completed at 4 weeks of the pregnancy. So just about the time us ladies figure out that we're pregnant, the heart and the spine are pretty much formed. When there's an issue with the closure, actually if the closure is not completed or maybe almost completed, but there's a little piece that's still open, that's called a neural tube defect. Now, if that closure does not happen properly, depending on how bad it is, for example, if there's a neural tube defect that's closer to the head, those in general tend to be a little worse than the ones that are at the spine, the tailbone. You can get nerve damage, in part because the spinal cord nerves are floating in the amniotic fluid, and so it's exposed to elements that it's not supposed to be exposed to, and that can cause nerve damage leading to bowel or bladder problems at a minimum. Sometimes you can get hydrocephalus, which is a buildup of excess spinal fluid in the ventricular system in the brain. So that's what a neural tube defect is. Now, how do we screen? We screen by either blood test, which is serum alpha fetal protein, where if there is an abnormality or an elevation in that can give us an idea on if there is a problem with the spinal cord. However, the AFP as a blood test by itself, there are other reasons why it can be elevated outside of an abnormality for the spine. The diagnosis is really a very detailed ultrasound, looking at elements in the brain and looking very closely to the entire length of the spine and the transverse axis of the spine, making sure that there are no obvious defects or even a subtle defect called a meningomyelocele. And that's really, ultrasound is the diagnostic mode. How do we manage that? Well, it used to be traditionally that depending on what was found, you just had to wait until after the baby was born and then do surgery after birth. However, there was a study that came out, it's called a MOMS trial, management of meningomyelocele, where they looked at prenatal surgery. So yeah, you heard that. That's surgery that's done on the baby while you're pregnant to close that defect. And there's certain criteria for it, and I'm not going to go into details for that. But they looked at prenatal surgery versus traditional surgery, which is surgery after birth. And basically the study showed better outcomes if the surgery was performed in utero. So that's something to consider if any of you ladies have or know of somebody whose baby has a spina bifida, it's worth a conversation, it's worth a consultation to see if at the time of diagnosis the baby is a candidate for in utero closure, because that could give better outcomes. So that's it for our congenital defects. Again, this is Dr. Heather Stanley coming to you from someplace other than Claremont. Wishing you a happy hump day. Want you to breathe, walk good, and be kind to each other. Take care.